Hello, my name is Danielle Ryan and I'm the coordinator for the Cognitive Behavioural Therapy or CBT service within the Southern Health and Social Care Trust. The CBT service sits within Primary Mental Health Care Services, and there are 9 therapists supported by admin working within our team, and the therapists are based across different locations within the Southern Health and Social Care Trust. And as well as offering one-to-one face-to-face appointments, we also offer virtual appointments within the service. The theme of this year's Mental Health Awareness Week is anxiety, and research has indicated that cognitive behavioural therapy is an effective treatment for anxiety. You also hear CBT referred to as a talking therapy or psychological therapy. The types of anxiety presentations that we would see and treat here in the CBT service can include panic disorder, social anxiety disorder, generalised anxiety disorder, obsessive compulsive disorder, and post-traumatic stress disorder. The theory behind CBT suggests that there is a connection between our thoughts, our bodily sensations, our emotions, and our behaviour, and that what we think and what we do affects how we feel. When we're experiencing distressing emotions such as anxiety, then it's likely that our thinking has changed. We're thinking more in helpful ways, and our behaviour has changed as well. So we might tend to be avoiding or doing other behaviours to help us to cope. Maybe, for example, seeking a lot of reassurance. Maybe we're engaging in a lot of check-in behaviours, or using other more subtle forms of behaving in order to help us to feel safe and to cope better. What we do in the CBT service is help you to identify your own thinking patterns and your own behaviours with regards to the situations that you're experiencing difficulty with, help you to understand the vicious cycle of anxiety and what's keeping it going, and learn ways to reevaluate your thinking or to change your behaviour, test out new behaviours, test out new ways of acting to see whether that can help to break into the vicious cycle and ultimately help you to start to feel better. Over the next few moments, some of our therapists working within the team are going to give you some tips that you could use to maybe understand anxiety a bit better and learn to help yourself should you be experiencing any of these unhelpful or distressing symptoms.
Hi, my name is Sarah. I'm one of the CBT therapists here in the team, and today I'm going to talk about what anxiety is. Anxiety is the feeling of unease, such as worry or fear, that can range from mild to moderate to severe. Everyone has feelings of anxiety at some point in their life. For example, you may feel worried and anxious about sitting an exam, going for a medical test, or going for a job interview. During times like this, feeling anxious can be perfectly normal. Anxiety is the natural human response when we feel that we are under threat. This is better known as fight or flight. The fight or flight response is an automatic survival mechanism which prepares our body to take action when we perceive danger. All of the bodily sensations produced are happening for good reason, to prepare your body to run away or fight, but this may be an uncomfortable experience when you do not know why they are happening. Most people have experienced these physical symptoms of anxiety at some point in their lives. An example of this would be your heart racing faster, finding it harder to get a breath, or having butterflies in your stomach. You may feel your muscles become intense, feeling dizzy or lightheaded, and find that your thoughts are racing. While anxiety is a normal emotion that most people experience at some point in their lives, some people can find it hard to control their anxiety and their worry. These feelings are more constant and can affect all areas of their life.
My name is Fiona Jennings, and I am one of the CBT therapists on the team, and I'm going to speak to you about the vicious cycle of anxiety. As Sarah said, some people struggle to manage their anxiety, and this can be described as the vicious cycle of anxiety. A good starting point is to identify your triggers or sources of anxiety. Ask yourself the following questions. What situations do you feel most anxious in? What are you thinking? How do you respond in these situations? And consider how is it affecting your life. The essence of anxiety is worrying about some potential threat. It is trying to cope with a future event that you think will be negative. You do this by paying more attention to the possible signs of threat and looking internally to see whether you will be able to cope with the threat. When you notice your anxious symptoms, you think that you can't cope with the situation and therefore become more anxious. This is the start of the vicious cycle. When you notice the physical symptoms of anxiety as described by Sarah in fight or flight, it makes sense that you will do things to reduce your anxiety. As anxiety is a feeling of intense discomfort, it drives people to avoid their feared situation altogether to try and reduce the anxiety. This avoidance instantly decreases the anxiety because you have not put yourself in the distressing situation. It's important to understand that every time you avoid an anxiety-producing situation, your anxiety will be even worse next time around. The brain sees it like this. When I avoid this situation, I feel better. I guess I should try to avoid it next time too. However, while avoidance makes anxiety better in the short term, you've also made the anxiety worse in the long term. You continue to believe that the emotion of anxiety is dangerous and should be avoided at all costs. By doing this, you are not disconfirming your catastrophic predictions about what might happen.
So how can we change this? How can we focus on our thoughts? We need to be able to understand and challenge our thinking. As mentioned before, CBT works by identifying and addressing how a person's thoughts and behaviours interact to create anxiety. So it's really helpful to practice identifying your thoughts when you are anxious. Think about recording your thoughts that you have during a situation when you felt anxious and how you responded. What did you do? How did you feel emotionally? By practicing this, you will begin to notice your thoughts that contribute to your anxiety. The next step is to challenge these thoughts, looking for evidence that supports these thoughts, while asking yourself the question, am I making an assumption? Do I have good reason to be anxious? The idea is to begin to think neutrally rather than have a negative and to put fear into perspective. We all engage in unhelpful thinking habits. We may have our heart beating really fast and think we're going to have a heart attack. We may feel a little bit lightheaded and we think we're going to have a faint. We use opinion at times rather than facts. If someone we know walks past us without saying hello, we may think, oh, I can't believe they ignored me. Are they not speaking to me? They don't like me. This may lead us to feeling upset and react in ways that are unhelpful. The only fact is that the person walked past. Anything else is an opinion, our own personal interpretation of the event. And the reality may just be that they didn't see us, that they had far too many things on their mind. Remember, thinking doesn't make it so.
Hello, my name is Katie Newell, CBT therapist, and I'm going to discuss behavioural strategies we can use to break the cycle of anxiety. As my colleague Fiona mentioned, avoidance plays a big role in keeping our anxiety going. The more we avoid something, the less opportunity we have for ever overcoming it, or for ever learning that it wasn't as bad as we thought it was, or that we could in fact cope. So there are other ways we can avoid, which might be more subtle, and those are through the use of safety behaviours. These are things that we do in the moment to make ourselves feel safer. And while they might actually be quite effective at making us feel safer at the moment, they prevent us from fully confronting and fully engaging with the thing that makes us feel anxious. And in turn, they make our anxiety more problematic for us in the long run. So let's say, for example, social anxiety is a problem for you and you want to go to this party. So you go to the party, but you sit in the corner. You sit there with your head down and you look at your phone for the duration of the time that you're there. You don't make eye contact and you don't have any interactions with anyone for the whole time you're there. Technically, yes, you've gone to the party, but you haven't fully confronted it. You haven't fully engaged. And in fact, you've actually done a lot of avoidance while you were there. You might even think, phew, I got through that. Thank God that's over. I got through that though because I was able to use my phone and I didn't have to fully engage. So that might, for you, reinforce that as a helpful behaviour, but making you use it more often. But in the long run, it's just keeping your anxiety going. So in CBT, we would try and understand all of the different safety behaviours that you engage in, and we try and remove them one by one and replace them with more helpful strategies. The goal being then that you're able to confront situations without the need for any avoidance or safety behaviours, and that you can fully overcome your fears. Another process we would use is graded exposure. And this means gradually exposing yourself to the thing that you fear. We would do this through the process of developing an exposure hierarchy. So, for example, let's say the fear for you is public speaking, okay? And you have to deliver a presentation in university. So let's say this is the top of your list. 10 out of 10, level of distress for you delivering a presentation in uni. So what we would do is we would develop a hierarchy, a list of say 10 things, ranking them from least to most anxiety provoking, and we would start from the bottom. And once you feel ready to move, once you've overcome one step, then you progress on to the next step, gradually working up to the top of the step ladder. This works through a process of habituation. By confronting these things that make you feel anxious, your brain learns that this is not a threat for you, or that you are in fact able to cope. And it's through this process of doing it that it creates new learning and over time gradually reduces your anxiety. Graded exposure is a really useful way for overcoming your fears and systematically overcoming and beating anxiety.